Hi, and welcome to the Child Fatality Prevention System training offered by the Colorado Department of Public Health and Environment's Child Fatality Prevention System staff. This webinar reflects information that was presented at the Regional Child Fatality Prevention System trainings that took place in late October, early November 2013, and provides just the key information that local communities need to know about how to form their own teams. The learning objectives for this webinar are mainly to help you learn about the Child Fatality Review System. We're going to talk about what this means, why they're valuable, and how the Colorado Child Fatality Prevention System will work. As most of you probably are aware, there was legislation that was revised in the 2013 legislative session that changed how the Child Fatality Review process is going to happen in Colorado. So we will talk a little bit about what those changes are and give you some initial ideas of what the implementation is going to look like. We also are going to speak about understanding the differences between the Department of Human Services Child Fatality Review Team and that process and the Public Health Child Fatality Review teams that we'll be discussing today. That many of you listening to this may actually be more familiar with the human service model of child fatality reviews, but there are some key differences. So we'll go into detail about what some of those are and where we overlap, and most importantly, how we'll work together to identify prevention strategies for child maltreatment in Colorado. We also will give you some information just about what to think about when designing your local review teams. So we will present some different options for forming local review teams. As you may, if you've read the legislation, know there's some language in there that ask local public health agencies to pull local teams together, but there's some different options for doing that. So we will give you some information about that. And then we'll provide an overview of the major deadlines and the timing of case reviews so you get a sense of how this all works once it's up and running. And then, most importantly, we'll also learn about the technical assistance opportunities that's going to be available through the Colorado Department of Public Health and Environment, which is charged as providing the staff for the Child Fatality Prevention System at the state level. We really want you to see all of us on the Child Fatality Prevention System staff here at CDPHE as extensions of your team, and we really are part of one large system. So learning how the system will work together is one of our key objectives for this webinar this afternoon or this morning.
Hi, my name is Colleen Kapsamalis. I'm the Child Fatality Prevention System Program Manager. I'll be providing oversight to the system as a whole, as well as facilitating and helping defining the role for the state review team moving forward. Looking forward to working with everyone.
Hi, my name is Leah Emmerke Anderson, and I'll be the Technical Assistance and Child Fatality Prevention Coordinator. So I will be available to help you all if you have questions as you're starting to use the tool, or if you just need me to come out and help you facilitate the meetings. Look forward to meeting everyone.
Hi everyone, my name is Julie Richenberger. I am the Records Abstractor for the state, and my role is to enter case data until that job is taken over by the local teams. I look forward to working with you, and I'm happy to help in any way.
Hi, I'm Beth Secor. I'm the statistical analyst, and I'm going to be here to help you guys figure out how to enter the data into the case reporting system. And I'm also going to be analyzing the data and cleaning it up and summarizing the results for you guys by county or region. So I look forward to working with you.
Hi, I'm Shelley Marks. I'm the Data Coordinator and Abstractor for the Sudden Unexpected Infant Death, or SUID, case review here at the Colorado Department of Public Health. I have experience requesting, reviewing, and abstracting all cases related to child fatality review. I look forward to assisting you with your SUID and CFR questions, especially questions regarding the release of information, the confidentiality of health information, and how to help you find the most effective and efficient ways to obtaining documents and managing your records.
Hi, my name is Aimee Trudeau, and I'm a Public Health Prevention Service Fellow from the Centers for Disease Control. I have 1 year remaining here at the Colorado Department of Public Health and Environment, and I will be working with existing local child fatality review teams in implementing prevention initiatives. So I will be helping local teams to identify prevention strategies and then implement them within their local communities. I look forward to working with you.
Hi everyone, my name is Lindsay Myers and I'm the Injury and Violence Prevention Unit Manager at the Colorado Department of Public Health and Environment, and the Child Fatality Prevention System program falls under my unit, and I'm going to be working closely with the rest of the team to make sure that our whole new system takes off. Looking forward to working with you. What is child fatality review? I think one of the easiest ways to understand child fatality review in a real, snapshot kind of quick way is to view a short video from a local child fatality review team in Wisconsin. They were generous enough to let us use this video to help demonstrate to all of our partners across the state really what this is about. So take a quick listen to this 2-minute video, and then we will come back and hopefully you'll have a better sense of what this is talking about.
Have you saved a life today?
The wind was blowing in the right direction, which caused a lot of turbulence in the water and an undertow. And because of that, one of the 3 boys were actually picked up by the undertow and dragged towards the pier.
That tragedy could happen again, and it was through the endeavors of the Child Death Review Team, the Park and Rec, and all the other services in the city that we got together and we formulated a plan to help eliminate and reduce those risk factors within that swimming area.
Once we worked with our team and the Death Review Team, we created a new system to try to prevent this from happening in the future. Number one, our lifeguards are much tougher on their enforcement. We created a new grab line. We have a jet ski for a quicker response. All those things and a lot of education is going to help us try to prevent this in the future.
Child Death Review Teams are across the country. They are imperative for communities to be able to get together collaboratively to talk about prevention activities. Without these teams being in place, a lot of times these deaths go unnoticed.
It's all about saving lives. That's what it's all about.
Thank you for saving the lives of kids like me.
So as you can see from the video there, this really is all about prevention. I think that video is a nice snapshot of looking at the whole process. So going from, taking a look at a trend and a pattern that was occurring in a specific community, and then working together to think of some solutions and implementing them to try to protect children in our communities. So child fatality review really is where good shift happens. It's about moving from bad things just happen to we can prevent this. And you'll hear us say this throughout the webinar and throughout the TA that we provide to your local teams moving forward, that really the point of all of this is really the prevention efforts and the expertise that lies within communities to be able to implement them. So child fatality review in a nutshell, just to put a little bit more kind of theory behind it, it has some different components. First, it's an engaged, multidisciplinary community process where you tell a child's story, one child at a time, to understand the causal pathway that leads to a child's death for the purpose of identifying pre-existing vulnerabilities and circumstances that will help us identify how to interrupt the pathway for other children. So some of the things that local teams struggle with sometimes is kind of taking the fact that we, from the public health approach, are really going to use these individual stories to collect data. We're going to be using a standardized data collection form that I'll show you in a little bit to collect it in a systematic way. But then the focus is really going to turn to aggregating that information and taking a public health approach to identify trends and patterns and prevention strategies. So for those of you who maybe are familiar with the public health approach, this process does walk through that entire, public health cycle, from learning, identifying what your problem areas are, to looking at specific risk and protective factors that may exist for certain types of death in certain instances, identifying what best practices say, looking at possible interventions, and then implementing and evaluating those interventions to see if you have an impact. It's also a process that works at many different levels. So it works for recommendations at the individual level. So perhaps, things that individuals, parents, for example, can do to help keep their children safe, to community and societal level factors. So looking at our agencies and the systems that are there to protect children, as well as the societal factors, so laws and policies and other strategies that can really influence a child's health and safety. And then most importantly, it's about taking action to improve these systems, or to prevent and ultimately, hopefully, prevent the deaths that occur from there. So what's the value add? Why do we even want to do this in the first place? One of the benefits for child fatality review is it really is a professional interweaving from different systems and works to destroy silos. So all of us, in a community, coming from our different perspectives, if you've taken a look at the legislation, you see that this is a very multidisciplinary process, and each of our systems, or each of our kind of agencies' perspectives, have something different to offer. And so child fatality review, and this process that we're discussing today, really brings together all of those disciplines and asks us to have coordinated conversations about children. When a child death occurs, it's really impactful, obviously, for the family that's experiencing a loss, but it's also, really impacts the community as a whole, including the agencies that investigate the deaths, including the agencies that may have interacted with the families, prior to the circumstances leading to the death. And so sometimes, having space and time to come together and really have a coordinated conversation about what happened is what we need to do. It also engenders respect for families. So this is that idea of taking something, a terrible tragedy that's occurred, but really trying to learn something from it, and not just thinking, well, bad things happen, really taking a look at it and thinking about how can we, use this unfortunate circumstance to protect children in the future. It also drives quality improvements. You'll see throughout this process that, there's a lot of opportunity for discussion, and a lot of opportunity just through looking at these individual circumstances to highlight some areas where systems could be better within particular agencies, or perhaps in between agencies. And so the process really is meant to drive those quality improvements. It also creates opportunities for professional debriefing. As I mentioned, many of the players around the table in a child fatality review team are investigating agencies, and the death of a child really does impact the individuals that go out on scene and work with the families in the aftermath of these deaths. And so creating an opportunity for professional debriefing and to have people come together and kind of talk about what went well and what the opportunities were for improving things should this circumstance come up again is very important. This process also uses qualitative and quantitative data to inform prevention. So as a public health person myself, this is, one of the key areas that, is really rich within the child fatality review system, is that it is taking a look, collecting data in a systematic way, and then using that data to inform the prevention strategies that are implemented in local communities and at the state level. It also quickly lays out this case for prevention with the right people at the table. So rather than having to, brainstorm prevention strategies in a kind of agency-specific or siloed way, and then having to do outreach, to different agencies to make them happen, hopefully you've got all the right people at the table from the beginning, and you can just move forward on some of those prevention or systems improvement strategies immediately from the beginning. This process also fosters a community response to real community problems. So again, this is about, trying to be proactive for the future and really focus on, what we can learn in order to protect kids that may find themselves in similar situations down the road. And then one of the things I think in terms of the regional meetings that we had across the state that I really saw happening, we actually added this bullet point after the trainings were over, looking at all of the opportunities to learn how different agencies work is a value of this process in and of itself. So, being able to sit around the table with different disciplines that you may not, you may interact with a little bit, but not to the extent that you're really trying to understand what their perspective is and how their system works. So understanding how law enforcement investigates cases, understanding the constraints that human services is under when evaluating, whether children should be removed from the home or other types of interventions. And then having perhaps injury prevention people from public health that really have a good understanding of the best practices and what the literature say. And I think this process really does build relationships, and it strengthens communication and coordination between agencies just because the players around the table are able to learn a little bit more about each other and how the different agencies in a community work. As a video in the beginning of this webinar indicated from Wisconsin, there are child fatality review teams across the country. These teams have some common essential elements that make them work, particularly from the public health perspective. One is that they're multidisciplinary, so bringing together partners from across different agencies to have a discussion, again in a coordinated way, is very essential to this process working. The second is that you're telling a story or you're collecting the circumstances on specific cases by using multiple sources of information. So the data collection tool that we will be using for this process is a national data collection tool, and it's unique in that it pulls together information from a variety of sources such as autopsy records, law enforcement records, hospital records, death certificates, birth certificates, human service records, etc., and takes all that information and compiles it in one place so that you can really look at the trends and patterns of child deaths. It also is a process that's focused on improving systems and the prevention of deaths, not on culpability. So what this process is not is a criticism of the investigating agencies or something that the blaming the families of the children who have died. That's not what this process is about. This system, and you'll hear a little bit more when I talk about the timing of when these case reviews are going to happen, are not part of the investigative process. And so, it's not about finding somebody at fault. It's about identifying opportunities to prevent similar deaths in the future. And so as we move forward, this is a lot of the training and technical assistance that we'll be providing to local team coordinators and local teams as a whole when asked to really make sure that the conversations about these child deaths remain focused in that way, looking ahead rather than looking behind and thinking of specific people that could have done something different or agencies that perhaps needed to have a different response. It's not about culpability or blaming. It is about moving forward and improving systems. It's also this balance between individual cases and the accumulation of data for trends. So as I mentioned, some local teams or teams across the country struggle with this a little bit because we are asking you to look at individual instances of child death and compiling information from the variety of sources about this particular case onto the data collection tool. So you will be having conversations about individual cases. However, unlike human service reviews or other types of fatality reviews, we are not going to make or publicize broad-based prevention recommendations based on one individual case. Instead, we're going to wait until we accumulate data from many cases in order to make those trends. And so one of the ways that the local team structure and the state team structure for this process will work together as one system is that the local teams, will be providing the information on individual cases, and we'll be using that as a place to brainstorm ideas, that local teams may have about how to improve systems or how to do community-based prevention strategies, and then that information will be input into the system, and then the state review team will be looking at it from a slightly different perspective and making recommendations using the information that you all provide at the local level, and then looking at those trends and patterns of child deaths across the state and broken down into different regions and different different ways of splitting the data up to identify the prevention strategies, primarily at the state level that might, as a whole, protect our children in all communities. So again, and you'll hear me say this again and again and again, this is not blame and shame. And, just to be upfront, there's a lot of fear sometimes about these child fatality review processes because people feel uncomfortable about, coming together and kind of, talking about everything they did or didn't do. And, of course, hindsight is 20/20, and likely when these deaths occur, of course, there's things that agencies wish they would have done differently or would have seen earlier, or, other types of, concerns that people may have. But again, focusing a conversation where we're blaming or focused on the past so much is not a productive conversation and isn't engendering that respect for the families and the child who has died in the way that this process is meant to do. So, something just to keep in the back of your mind. This is certainly not about blame and shame. It is about the prevention of child deaths for kids in the future. So just a little bit more information about child fatality review programs across the country and where we fit in the big scheme of things. One thing to note is that in Colorado, we use the term child fatality review, or you may hear us say child CFR for short, or CFPS, Child Fatality Prevention System. However, outside Colorado, you may hear of Child Fatality Review, or CFR, referred to as Child Death Review. So just one note, these are the exact same thing, so don't get confused if you hear that other term. And in fact, the data collection tool that we use, the official name is Child Death Review Case Reporting System. So this is just, in Colorado, because our legislation uses the term fatality, we tend to use that instead of death, but these are the exact same thing. As I mentioned, all states have well-established child fatality review programs from the public health perspective, so we're certainly not alone in that. Additionally, 41 states have state laws that mandate or support child fatality review. So again, the vast majority of states have legislation like we do mandating that this process occur. 37 states have community teams and state boards. So this is the structure that we in Colorado now will have and have to have fully established by January 1st, 2015. Prior to the legislation being updated in Colorado last legislative session, we were a bit of an anomaly in terms of really only having a state review process that's mandated and then an optional kind of authorizing language, I guess, for local teams to form if they wish to. And so, as you might imagine, in our previous legislation, because it wasn't mandatory and because the previous legislation did not include any sort of financial support for the state or local level processes, we did not have a lot of teams local teams forming. There are a few that have formed, some that are still existing, and others that have kind of disbanded over time due to lack of resources and other types of things. So now we're in the process of rebuilding and moving to a structure that a majority of states have, which is a complete system that has local teams as well as a state team that's looking at those aggregated trends and patterns. 40 states utilize the National Child Fatality Review Case Reporting System, or Child Death Review Case Reporting System. The benefit of this is that we are able to use a resource that's free of charge to us in Colorado. This is supported by HRSA at the federal level, and the data system is supported through the Michigan Public Health Institute in Michigan, who has some staff that kind of oversee and help with the data system. So it's nice because we do have some ability, if we wanted to compare our data to other states that are using the system as well. And it also has a lot of, I think, really good features for local teams to be able to use and, figure out how to really pull the data that they need from the system. So we'll be going over all of that in a little bit. And then most child fatality reviews are funded with maternal and child health or child protection dollars. This was true in Colorado until recently as well. So, just a brief history of child fatality review in Colorado. We have been reviewing child fatality since 1989, in Colorado, and it started as a collaboration between the State Department of Human Services and the State Health Department to really, coordinate and talk about child maltreatment deaths, but then it quickly expanded to other types of deaths. And really wanting to use the public health approach to identify opportunities for prevention strategies and that kind of thing. Our first legislation went into place in 2005 and then was again revised in 2013. So the 2005 legislation did not include any fiscal note with it. So we were kind of piecemealing money together, some from maternal and child health, and then we also had a little bit of money from CDHS through their CAPTA dollars, federal child protection dollars, to implement the process. But again, it was very, very bare bones, and the reason why many of you may not have even realized that we had a child fatality review process is because we had no funding really to produce reports that were comprehensive or to do things and really that would really impact prevention in a real visible way, because we were just sort of piecemealing staff to work on the project and really operated a lot from the volunteer hours from the state team members. So we went very quickly last year during the legislative session from being one of the most underfunded states for this process to now being one of the better funded states. So it's a real opportunity in Colorado, and there's a lot of interest in seeing how we design our processes and how we make this work at the national level. So just a little bit about some best practices, and you may be wondering, why were there changes to our legislation and how did these come to be? One of the things that our legislators did when they first started talking about this was invite Terry Covington from the National Center for Child Death Review to come to Colorado and do presentations for groups of legislators and probably, just kind of offer her expertise and advice about how to improve the child fatality prevention system in Colorado. And so the first thing that Terry Covington told our legislators was that a local child fatality review team model is considered best practice. And there's a variety of reasons for this, but the basic idea is that, the local child fatality review teams operate on a principle that the death of a child is a community responsibility, and more than that, the solutions and the opportunities to really prevent child deaths happen at the local level and not at the state level. So to really, tie these reviews closely to prevention, they need to be happening with community members that really understand the community context and what resources are available and how agencies work together. And as you all know, there's a lot of differences throughout Colorado, both in urban and rural areas, mountain towns versus plains towns, and a lot of diversity in our state. And so the idea that one state board can know everything about every community and really make meaningful prevention recommendations really just doesn't make a lot of sense, or didn't to the National Center for Child Death Review. And so this was the first and the biggest change that Terry Covington wanted to see in Colorado, and as you can tell from the legislation, our legislators listened, and that is why the system is moving to a local level. Local level child fatality review systems require multidisciplinary participation from the community in order to improve communication linkages among local agencies and enhance coordination efforts. So again, bringing together the partners across these different disciplines in a community setting and having them explain, kind of what happened, both improves sort of the data collection process for this, as well as, again, knowing that the expertise to protect children lies within individual communities and not, kind of at the state level. In general, state-level child fatality reviews are considered not to be as effective as local reviews because the state review team members are not familiar with all local communities in Colorado. I can tell you from being involved in our state team for the last 5 years or so, the recommendations coming from the state team are only an inch deep because we, really, though we have a lot of experts around the table and a lot of, great ideas, we really can't make strong, meaningful recommendations because we don't know what's going on in communities. We don't know what's necessarily, going to make sense and what's going to be doable for a particular location or a particular issue. So really, having a system like our new system is coming to be, where it's connected and where there's opportunity for, local communities and local agencies to drive the prevention and systems improvement process is really what our new opportunity is with this legislation. So let's turn and talk a little bit about the data that you will now be reviewing at the local level. I'm sure many of you are curious about how many cases you have left to review and what sort of the data looks like. If you've seen a copy of the legislation, then you'll know that there are specific types of child death that are indicated that are mandatory to receive an individual level case review, and others that are not mentioned. One thing to keep in mind as I go into this is that local review teams are welcome to review all child deaths. The legislation allows for all child deaths to have an individual case review. However, there are some types of death that are mandatory that this happens and some that there's not. So I'm going to explain a little bit about that. If you have not seen a copy of the legislation, you can find a copy on our childfatality.prevention.com website, and we'll be showing you a screenshot of that in just a little bit. So the average number of child deaths in Colorado. On average, for the last 5 years, Colorado has had around 650 deaths a year of children under age 18 that occurred in Colorado. So one thing to keep in mind about the Colorado Child Fatality Prevention System is that we are looking at Colorado death occurrences, not just Colorado resident deaths. So these are all deaths that occur in the state of Colorado, regardless of whether the person lived here or somewhere else. About 10%, I guess not many, but 10% of our deaths each year are out-of-state residents. A majority of those are either motor vehicle crashes, people, traveling down I-70 or I-25 from other states, or, we also have a lot of tourism here, and so sometimes we'll get ski-related fatalities. Almost all of our childhood ski fatalities are out-of-state residents in Colorado, and so we're really concerned about protecting the children that are in our state at all times, regardless of where they may live. This process does not review Colorado resident deaths that occur in other states. So if one of our child residents goes to visit a grandparent or someone else in another state and unfortunately passes away, that is a case that would not be reviewed in this system. There's some rules around how jurisdictions work and what our ability to collect information and records on child deaths is really about trying to we're only allowed to look at the deaths that occur in Colorado per that statute. So this 650 deaths, and again, this is one of the big successes of child fatality review, I think, or for Colorado as a whole, is this number is about 100 deaths less than it used to be. We used to have a very high number of teen motor vehicle fatalities, and something that this child fatality review process was monitoring really closely for many years. And the data from child Fatality Prevention System was used to look at the trends and patterns of those motor vehicle deaths and looking at some of the circumstances, and recognized that we needed a stronger graduated driver's license law. And our state team had made recommendations to the legislature, as well as provided information around, kind of what we were seeing in our case findings. And the legislature did decide to act and passed a graduated driver's license law, which is the law that eases young drivers into the getting a full license. So there's passenger restrictions and nighttime restrictions and a couple of other components for that. But as a result of that legislation, Colorado has seen teen motor vehicle deaths decline by about 69%. And so that is a real big success and win for us in Colorado, and something that we're proud of from this system, because information from the system was certainly used for that process, and that's about why we see about 100 less deaths than we used to a year. So anyway, so the 650 deaths that we have a year, we kind of split these into two categories. One is natural deaths without clear preventability, and this is a majority of deaths. So 450 of our 650 are ruled by coroners as natural manner deaths, and most of them have medical causes. And while there may be some prevention strategies associated with them, they're not quite as apparent, and they don't necessarily involve kind of the multi-agency approach that this process is going to be using. So these deaths are primarily infant deaths of kids, a lot of them neonatal deaths under 28 days old for prematurity or abnormalities, other types of, kinds of medical causes. So this system, in terms of what is required for us to review, does not have to review all natural deaths. So we split out the ones that are in the legislation kind of, listed as things that we need to be reviewing. You'll see in the legislation the term used, preventable child death, and they have slightly different definitions than this particular slide shows, but I think I wanted to just show you how we select and will be selecting the deaths at the state level to be able to determine what cases are going to receive a full review, or which ones are mandatory. So we look at the manner on the death certificate. So there's 5 manners on the death certificate. Natural is one, and then there's suicide manner, homicide manner, accidental manner, and undetermined manner. So these are ruled by the coroner and have a variety of causes within those manners, of course. But these are and then there's also natural SIDS. So natural SIDS is included because there's some differences depending on the level of information available to investigators and coroners at the time a cause of death is ruled. There are infant sleep-related deaths that are sometimes ruled natural manner SIDS, sudden infant death syndrome, as well as some that are ruled accidental suffocation, or some that are just ruled undetermined. And because those are all very similar types of circumstances, we decided that we were going to include all natural SIDS case in our review, so that we can catch those nuances and make sure that we can aggregate those infant sleep-related deaths together, regardless of what the official diagnosis was from the coroner or medical examiner. So about 200 of the 650 are the cases that we're just, for lack of a better term, kind of calling preventable child deaths. So these are the numbers that are required. In addition to this 200, there are some natural deaths that when we go through and look at each and every death certificate, we may flag for a review for a variety of reasons, because we can perhaps see some prevention opportunities with these particular deaths. So an example might be a meningitis death. There certainly may be some prevention strategies or immunization strategies that might prevent that death. We may pull in a case for cerebral palsy because the circumstance precipitating that child having cerebral palsy with shaken baby in infancy. So we were, we would try to take a look at those death certificates. We use our state team to do this, doctors and medical examiners or coroners that are helping us look through the death certificates and pull out the things that, may have some prevention strategies or may just be a little bit odd for some kind of reason. So a type of death that's a little bit strange for a particular age group or something like that that we would pull. So together, we are planning to assign 220 child deaths to local review teams for review. And this is kind of the number that we're on average working with. It will vary a little bit year to year, of course, but on average, that's how many we're going to be doing this full process on. And again, just to reiterate, if local teams want to know and review deaths for all of the, any cause, whether they were natural manner or any of the other four manner types, that is perfectly fine. You can just let us know, but it's not mandatory or required that you do so. So I want to spend just a little bit time talking about the child maltreatment deaths because these are a little bit different, and as I mentioned at the beginning, several of you may be more familiar with the Human Service Child Fatality Review process than you are with the public health approach. So I just wanted to clarify what some of the differences are. So if we take the blue bubble here is that 200 or so, 220 preventable child deaths that are going to fall in suicide manner, accidental manner, homicide manner, undetermined, or natural SIDS. Those are all the deaths that we're going to take a really close look at and collect circumstance data on. In those 200-ish deaths a year, there are potential child abuse and neglect deaths. There is not an official cause of death listed on a death certificate as child abuse. You'll see the cause as shaken baby, or you'll see the cause as severe malnutrition or something like that, but you won't see as a particular cause child abuse or neglect listed on the death certificate. So because of that, we've got to identify which cases those are using other factors. Now, for the most part, if you've got a homicide death of a child under age 5, almost always those deaths are child abuse and neglect related. So we do have a pretty good idea just looking at death certificates what type of child abuse and neglect numbers we have. But there's a lot of deaths, particularly on the neglect side, that are a little bit more difficult to make that determination. And part of, again, since public health's approach to child fatality review is to aggregate like cases and look at trends and patterns and really try to isolate what the risk factors are for different cases. We want to group as many different child abuse and neglect, or as many types of cases together, whether they were officially ruled child abuse and neglect by Human Services or whether there were charges filed or prosecuted charges against people for child abuse and neglect. So, this legislation that was revised in 2013 came about, about a year ago, and some of the questions that the legislators and the newspaper and other stakeholders were asking us at CDPHE to determine is, how many child abuse neglect deaths do we really have a year? And looking at our numbers, we have between 30 and 40 cases a year that our review team, state review team, has identified as possible child abuse and neglect cases. And we've included those cases in our aggregate analyses in order to identify risk factors and protective factors and, all of that kind of thing to take it through the public health process. There are about 12 cases a year where Child Protective Services or Department of Human Services actually ruled these deaths as abuse or neglect deaths. They filed charges, and they were, without a doubt, child abuse and neglect deaths. So when the newspaper and legislators asked the Department of Human Services how many child maltreatment deaths they had, they said 12. on average a year. Again, these are all just average numbers. So obviously there's a discrepancy between 12 cases known to human services that children that died of child maltreatment related circumstances versus when we're reporting 30 to 40 depending on the year and what occurred there. And so there's some good reasons why this is. But I think it's probably best to just give you an example and talk about how how this came to be. So we are looking at all child deaths for the purpose of identifying cases that human services didn't know about. And there are some circumstances where child protective services may not have been notified of a death occurring, of possible neglect, for example. If there's no other children in the home, if this family was never known to human services before the circumstances leading to the child death, or charges just weren't filed. There's a lot of reasons why they might not know about it, and it has nothing to do with them not doing their job or not protecting children. It just has to do with the fact that they weren't notified, that this family was not on their radar and not known to these services, and so they weren't tracking whether the child death occurred. So part of the reason why our Human Service Department and our State Health Department kind of collaborated on Child Fatality Review back in 1989 was to catch these cases that Human Services didn't know about, because of course child welfare wants to protect the welfare of all children and wants to know about cases that weren't necessarily in their system. So when we look at this, we're from the public health approach looking at 200 cases a year on average, and one of the questions that we'll be determining is whether child maltreatment was involved in this particular case. We will overlap with the Human Service Review for about 12 cases a year, and that is okay because we look at them in slightly different perspectives. So for example, Human Services has some strict criteria in their legislation about child fatality review that indicates what cases they review and which ones they don't. So in order to be reviewed in the Human Service Review Team perspective, the child has to have died of child abuse or neglect. The family has to have been known to Human Services and had an open case for an issue somehow related to the circumstance leading to the death within the last 3 years. So they're going to review that subset of cases, and their focus is really going to be on systems improvements within the Department of Human Services system. So they're looking at how to improve county human services, how to give better services to families. From the public health approach, we're taking a much broader perspective, and we're going to talk about the sort of the entire circumstance and what's going on at the community level and within other agencies, not just human services, in order to protect that child. So I think it's best just to use an example, one that probably some of you are familiar with. We know, looking at our child fatality review data, that one of the perpetrators that stands out for child abuse neglect deaths are a male partner of the biological mother who is not related to the child, so mom's boyfriend for the most part. Let's say that mom's boyfriend was the perpetrator of child abuse, and that this family was known to Human Services. County Human Services was providing assistance to the mom and had been working with her for a variety of things. Human Services may have known that there was a boyfriend in the picture, but had not had much or if any, interaction with that boyfriend. And so they're looking at, now this child has died, unfortunately, and they're looking at this case to determine what improvements can Human Services make to better protect the mom and the child in that instance. And so they're going to look at what services they provided, what opportunities there are for improving communication or systems or, whatever the issues might be in that case. When we look at it from the public health perspective, we're going to be looking at that same case, but we're going to focus on the perpetrator. We're going to focus on how can we stop a perpetrator from becoming a perpetrator? What do we know about this person? What are the risk factors of this particular group of people? And how can we identify some prevention strategies that are hopefully going to be effective in better preparing this man to become mom's boyfriend and have better skills to know how to take care of children and how to step away if a child is if they're driven to a point where they might shake a child or abuse a child. So just as an example, we actually did look at this, and one of the things that we were noticing in the data is that many of the mom's boyfriends who perpetrated child abuse were involved at some point in the juvenile justice system, in the probation system, somehow in the criminal justice system. And so we developed a pilot project in collaboration with the probation departments in Denver and in El Paso County to create a pilot project called ProDads, which required men on probation to take parenting classes, whether they were parents or not, as a condition for their parole. So this is a way that we were able to kind of look at a trend or a pattern that we were seeing in deaths across different areas across the state, and then thinking through what we know about best practice, which is some evidence-based parenting curricula that's out there, fathering curricula, and we were able to pilot test implementing that program in 2 specific areas that had high incidences of these cases, versus what Human Services may have done with this same case, which is make some changes internally with their protocols or with how instances were or how communication works within their agencies in order to provide better services to families. Additionally, another difference between Human Services and our child fatality review process from the public health level is that they also review in their fatality review near fatalities and egregious incidents. So while there's 12 cases on average per year that are fatal cases that were known to Human Services meeting that criteria for review, they also look at about 28 a year that are either near fatalities, so perhaps a child that's in the hospital and has very severe injuries but did not die from their abuse, or egregious incidents, which could include incidents where the child was not near death and in the hospital, but the abuse or the neglect was so severe that it very likely could have gone in that direction. I think Human Services is still working with their partners to put a stronger definition around what egregious incidents mean, but they're looking at both fatal and non-fatal cases. So we are only going to overlap with that team with these on average 12 a year that were fatal cases. So just to recap, because I know that was a lot of information, and it's very confusing in terms of the nomenclature for CFPS, Child Fatality Prevention System, and CFRT, Child Fatality Review Team. So this is just an unfortunate thing. This is how these groups were named in the legislation, and so here's some ways that you can think about the differences just to recap. So CFPS is the public health process. So you can think about it because the P stands for prevention, and that's really what this whole public health system is focused on, and for the most part primary prevention, so trying to prevent the incident of child abuse and neglect from ever happening in the first place, not just the response to that family after they're already at very high risk or already in a dangerous situation, though of course that's very important too. The other way to remember it is that the S, which is a system, so it's the connection between the state and local components that make up one large system. So again, from the public health perspective, the Child Fatality Prevention System reviews all child deaths to identify maltreatment cases unknown to the Human Service System. Our reviews of these cases will generally focus on whoever the perpetrator is and trying to look at the circumstances and what we know about that perpetrator or the larger community context that was going on at the time, and we're going to make recommendations based on aggregated case information. the Child Fatality Review Team, which is the Human Service Review. So they are reviewing all child deaths, near fatalities, and egregious incidents known to Department of Human Services, County Department of Human Services, within 3 years. Their focus for their review is going to focus on the Department of Human Services interaction with the family. And their recommendations are going to improve, geared toward improving human service systems. Another major difference is that the human service side of things is required by federal law to report recommendations and actions on individual cases. So in the public health perspective, we are never going to connect, this one recommendation that came from a local review team was recommended for this particular case, and this is what we're going to do about it. We're going to wait until we have a whole year's worth of cases in our system, and then we're going to look at those trends and patterns, and our recommendations are going to only be based on the aggregate data in terms of what's shared in any kind of public way. The human service side of things is required to report on individual cases and post that information on their website. So they are writing case summaries for each individual child death, and they're making specific recommendations for how they improved the system for that particular case and what actions, if any, that team took to or the county took to improve protocols or systems within their agency as a result of this one particular death. So it's a big distinction between the two teams. The new legislation, though, does require that the Public Health Review Team and the Human Service Review Team work together to issue joint recommendations to the legislature to prevent child maltreatment deaths. So we will be working, the State Child Fatality Prevention System Review Team will be working with the Human Service Review Team in order to make those joint recommendations and identify a process by which we can take all the information from their perspective about human services, as well as all of our information from the public health standpoint, looking in the broader community context and again focusing on the perpetrator if that's not the person that human services had involvement with, to kind of put the big picture together and issue those in a cohesive, coordinated way. Okay, so let's give just a brief overview of the new legislation. Hopefully you have a copy in front of you, or you again can find a copy on our collaboration website. So I'm going to break this into two parts, both what the local teams are going to do, and then what the state team is going to do. So first, who's on the team? There are two categories of team members, mandatory and optional, listed, and these are word for word as they are listed in the legislation. So on the mandatory list, of course, is the local public health agency. So the biggest change in the legislation, one of the biggest changes in the legislation was to put the responsibility for acting as a convener of local child fatality review teams with local public health. And that is going to be based on local public health's jurisdiction. Though the legislation also talks about that local public health agencies can decide to partner with each other to form regional teams. They can also delegate the responsibility of forming a team to a different agency within the community. So there's some options in terms of how the team gets formed and who's actually the coordinating agency, but regardless, the local public health agency needs to be on the team, whether they're leading the efforts or not. County Department of Human Services needs to be on the team, local law enforcement agencies. And again, for local law enforcement agencies, obviously there in some communities are quite a few law enforcement agencies, and then of course many different officers that are involved in that team. So our advice is, certainly have a connection with local law enforcement, but you may want to invite for particular discussions on particular cases once you find out that you have a case and know that a particular law enforcement agency responded to that particular instance, that you may want to invite an agency who isn't, on paper an official member of your team, but you want to invite them for this particular discussion. That is perfectly fine. But the idea is law enforcement, has information on most of the cases that are in this mandatory category for review. So having law enforcement representation on the team is very important. The district attorney's office is a mandatory member. This is something that's a little bit complicated because of the changes in how the local teams are forming in the legislation. Under the previous legislation, the onus to create local teams rested with the district attorney's office, and so teams were to form based on judicial district. Now the legislation requires that to happen by local public health agency jurisdiction, and so that might mean that district attorneys, that a particular team, particularly if local health agencies decide to combine and form a region, that they may have a couple of different district attorneys offices that would cover that local review team's jurisdiction as they define it. So again, our advice here is that certainly know who the district attorney's offices are in the area that is covered by your local team. Please, invite them to attend your meetings, share reports with them as we send them to you. But I don't think it's a fair expectation that all district attorneys are at every meeting any more than I think that that could happen for every single law enforcement agency represented at every meeting. So, it may be something where if the district attorney has some information that they have to a case, they may participate in your review, and if they don't, perhaps just being connected with your team virtually through email and contact is enough. But the legislation does list district attorneys as mandatory members. School districts are also listed. Again, probably there's many different school districts in your area, or if you are forming a regional team, that can mean different school districts for different counties, etc. So the idea here is having somebody who represents sort of the school voice and knows how school works can be very valuable to have on your team, because a lot of the prevention strategies that you may be coming up with might have school settings as one of the intervention areas that you could implement some of the prevention strategies. School districts also can be very helpful with information, particularly on suicide cases or cases where a child had really been involved with counselors at school or the administration at school. Sometimes they are willing to share some information for the purpose of trying to learn from the case and put some strategies in place to protect children in the future. But again, you're not going to have every school district in every county or even every school within every school district sitting at your meeting. So you may just invite school personnel on a case-by-case basis if you have a school-age kid. But having that representation and that voice at the table to learn from how school systems are set up and what the opportunities for prevention are can be certainly valuable. And then, of course, coroner's office or county medical examiner's office are mandatory members. You will have autopsies on almost every single case that you review, and so that information is essential for filling out the case report. And then the coroners are also very valuable team members, because a lot of times, they've had to investigate most of these deaths through their office and may have some information that can help supplement, answer some of the questions on the data collection tool. And most of them are willing to share information with local teams for the purpose of, trying to learn and move things forward for prevention. And then the last member that's listed in the mandatory side is county attorney's office. On the optional list, you'll see that it's almost everyone. The first listed in the legislation is hospital, trauma centers, and EMS. I actually wish that this group of stakeholders were listed under the mandatory section, because there are many instances in the cases that you'll review where you will need information from hospitals, trauma centers, or EMS trip reports. So I strongly encourage you to do some outreach with your hospitals in your area if you have one, because they can be very valuable. The other way that they are very valuable, aside from helping provide some information, is that a lot of hospitals have injury prevention staff as part of their trauma program there, and they can really help implement some of the strategies or maybe connected to other resources, and are just really very valuable members. We have several hospital staff that attend our state review team meetings, and they're just really valuable players to have at the table and to understand the perspective and the role that they play in trying to save children's lives. Other optional, I'll just go through these quickly: County Board of Social Services, mental health professionals, medical professionals, court-appointed special advocates, children's advocacy centers, private out-of-home placement centers, victims advocates, or other agencies or individuals. So as you can see, you can invite whoever you would like to be part of your team as a whole, or just for an individual meeting as you see fit. Members on the team, in terms of what the role is, a lot of people will provide information that's necessary for the data collection tool. They also provide their own discipline's perspective and can be really helpful in terms of identifying or helping think through how a circumstance may have happened, even if they weren't directly involved in a particular case. And then ideally, because this is now taking place in a community setting, some of these agencies or individuals on your local teams may be in a position to help you implement some of the prevention strategies that your team comes up with. So review team duties in the legislation, obviously the biggest one is to conduct case-specific multidisciplinary reviews of all preventable child deaths. So this is actually listed as it is in the legislation, so slightly different than I presented it on the previous slide with the manners. So in legislation, it talks about undetermined causes, unintentional injury, which would include drownings, falls, fires, prescription drug overdoses, poisoning, those types of things, violence, which would be any homicide, any firearm-related death, motor vehicle incidents, child abuse and neglect, sudden unexpected infant death, which are again the infant sleep-related or sleep environment deaths, and then suicide. Local teams will be responsible for gathering case records from a variety of sources, and there's different ways to do this. So, you will both be conducting the case-specific reviews, and you'll be gathering all of the information that you need to do that. So you can do that by just having members of your team bring it with them to the review, so you don't have to collect anything in advance. What we do at the state level is ask for records prior to the meeting so that we can read through everything, try to complete that data collection tool as much as we possibly can before our review team shows up for the meeting, and then we make edits and additions to it during the meeting. Or there's a possibility of doing some hybrid of these things where you would send out perhaps pieces of the tool or give access to multiple people to the data collection system in order to be able to enter their own information. But you are responsible for gathering the case records. You will also be responsible to enter the information from each case into the web-based data collection system, and we'll provide plenty of training on how to do this for the review team coordinators so that you know what you're doing, and we're also definitely available to help you do that, particularly at the beginning as you're doing these things for the first time. The legislation specifies that data has to be entered into the web-based data system within 2 months of the review meeting. The reason for this is just to make sure that the reviews get completed in a timely manner so that we can close out the data year and then move forward with identifying the trends and patterns of child death. Then, most importantly, local review teams are responsible for identifying risk factors and local prevention opportunities. So lots of things come up during these case reviews. We conducted some mock case reviews during the regional trainings that we did around the state, and really saw some really great thinking and strategizing happening even through these cases that weren't even real cases at the team. So really valuable to kind of think through what the risk factors and prevention opportunities are at the local level, and you may not even need to wait for some of the aggregate data. If you see something that's within your reach to implement in terms of prevention, you can move forward and just do that. So for the state team membership, we have on the state team officially 46 members. 18 of these members are governor appointments. The previous legislation had 17 governor appointments, but now the Ombudsman's Office is added to that list, so there are 18. There are 16 state agency appointments, and these are appointments from the Colorado Department of Public Health, the Colorado Department of Human Services, Department of Public Safety, and the Department of Education. And then there's 12 team selected appointments, which are individuals that are selected based on specific types of expertise that are needed for the reviews. So the governor appointees and the state agency appointees select these individuals, and then everyone is a voting member of the state team. What the state team duties are, you'll see in the legislation that the state team section is fairly lengthy, and the language that's used throughout is the state team will do this or will do that. This is their charge. But there's sort of state team duties that are really probably more Child Fatality Prevention System staff at CDPHE duties. So I will describe it in two pieces. This first slide here is about the state team duties, which are the duties of the 46-member team that we spoke about. So first is the state team will provide protocols and guidelines for local and regional teams. Because we've been reviewing deaths for a long time, and many members on the team are long-serving members of the state team, there's a lot of expertise there, and they know what works well in terms of how the meetings run and how the data is collected and those types of things. So they'll certainly be providing a lot of input in the protocols and guidelines that will be helpful to you at the local or regional team level to be able to implement. Our state team members will also help us at CDPHE provide training and technical assistance regarding the facilitation of child fatality review process, confidentiality, data collection, evidence-based prevention strategies, and the development of prevention recommendations. So, and then hopefully the implementation of those recommendations. So since our state team is just as multidisciplinary as your local teams will be, we really do have the opportunity to have some technical assistance if needed from different disciplines and not just from the public health perspective. So if law enforcement members, for example, are need some technical assistance around a particular topic, we could ask the law enforcement representatives on the state team to help us provide that technical assistance to you at the local or regional level. The state team, as I mentioned, will also be reviewing data and case information, but they are only going to be looking at aggregated data using the information that local child fatality review teams input into the web-based data system. So you will see in the legislation that the state team, it says that we're reviewing deaths for the purpose of trends and patterns. So the data that the state team will see now is not going to be individual case specific. It's going to be de-identified aggregated data, and they will be really looking for the trends and patterns of those deaths. However, the state review team is required to review child death cases that do not receive a local review for whatever reason that might be. So the local review teams, for right now, there's very few that are up and running. And so the state review team is currently reviewing all of the child deaths from 2012, and we're just going to be starting 2013 in a little bit here, so that we don't fall behind. So while all of you are forming your teams and thinking about how this will be structured best at the local level, the state team is still reviewing cases and picking that up until the local teams form. Moving down the road past January 1st, 2015, when we have local teams throughout the state team will only review cases in special circumstances. If a local team is unable to complete a review for whatever reason, or if the state team is specifically asked to review a case because perhaps it's a very high-profile case and the local community is uncomfortable or just a little too close to the circumstance to take a good look at it, there are a few instances where the state team may pick up those cases for the local teams. And again, since we're all part of one system, that works well. The other thing that will be available to you at the local level is if you need help facilitating your reviews, particularly at the beginning here while you're learning and trying to figure out what this is, our staff will also be available to come and help you do that if you need to. The state team's main charge for the legislation is actually to make policy recommendations to the legislature about the prevention of child deaths and creating safety and well-being for children throughout Colorado. So how this all kind of works as one big system is that the local review teams are inputting data and their prevention ideas, etc., into this case reporting system, and then the state team is looking at all of that aggregated data and the qualitative information from the recommendations that come from the local level to determine what the policy recommendations are that are going to move forward to the legislature. And then, as I mentioned, we are also going to look at, since we're looking at the data in many different types of combination, we will also be making recommendations to local communities based on what our state review team members know about best practices, and then again looking at the aggregated data. So the funding that is attached to this legislation is certainly not enough for you all to be able to look at your data and be able to have a data analyst and somebody looking at prevention strategies and looking at doing literature reviews, etc. However, that resource is going to be available to you both from state staff here at CDPHE as well as through our team members, which are experts in their own right in a variety of areas. And then, as I mentioned, we will be working with the Colorado Department of Human Services Child Fatality Review Team to issue joint prevention recommendations for child abuse and neglect fatalities. So the CDPHE specific duties include actually creating the draft protocols and guidelines for local teams. We'll be doing that in collaboration with the 46-member state team board, as well as in collaboration with all of you. And so we certainly, because we are all one system, need the processes and the way that everything's structured to really work for you, because otherwise the system as a whole won't work. So we'll be doing, though, the heavy lifting, creating of documents, that kind of thing. We will also be assisting each local or regional team in forming. We were successful in getting representation from every county in Colorado at least at one of our regional meetings over the last couple months. And so we are currently in the process of now starting to reach out to the people that attended that meeting from the local public health agencies to see what kind of assistance they need in helping to form teams. So we're available to come and meet with you in person, to meet via phone call, to help you facilitate a meeting where you're bringing together partners to really discuss how this might work best in your area. We're happy to do whatever would be helpful to you to get your teams up and running. We also will be providing individualized technical assistance to local teams, primarily to local team coordinators, to train on data collection, how to facilitate the reviews, how to enter the data into the system, and implementing prevention strategies. So those of you from small counties may be a little bit worried that, if you don't have a lot of cases to review, or it's possible that in a given year you might not have any cases to review, how can this training, really work, and what's sort of the timing there. So our idea is that each local team will have somebody that is designated as the coordinator of the team, and that most of this training will be going to that person to help them get these pieces that we need into the system. But for the regions or local counties that have really few child deaths, we will also be available to come and assist you with the review and can probably, help in real time how to do this process, particularly if you don't do it very often. So we are certainly available to help, and we'll be doing so throughout the state. We can travel and come to you, or sit in via conference call, whatever you are most comfortable with, and make sure that you're helpful. The team as a whole probably will not receive very much training from us as one group, unless you specifically ask us to come in and work with your entire team, and then we're happy to do so. We at CDPHE are also responsible for administering the money to local teams. We are going to identify cases to each local team to review. The purpose of this is to be able to get a nice overview of what cases are being reviewed by what team, so that we can make sure that we don't miss any. The intent of the legislation is that all child deaths meeting the criteria set forth in the legislation receive an individual level child case review, and so to make sure that that happens, we need to know who's reviewing what. So we will be identifying cases to you so that you know which cases you're responsible for, and then again, if you want to review more cases than what we assign to you, that's totally fine with us as well. But for the mandatory cases, we'll be assigning them to local teams. There'll be a process to tell us if we assign you a case that you think should not be yours. We'll have some process in place for you to send it back to us, and we can work it out. At CDPHE, we're also going to be responsible for aggregating and analyzing all the data entered into the web-based data system. This is the job of the statistical analyst, who I mentioned will be starting in January. We are going to be looking at all the data and aggregating it, both to show the state review team as well as to show the legislature and to show all of you, so that you have a nice snapshot of all the data that you've put in the system. We are required at CDPHE to provide annual data reports to each local or regional review team that summarizes your data entered into the system, and we can do this in a variety of ways. And if you're a county or a local team that did not review cases that year, we will still give you a report that highlights counties or sort of the data from the state level that would probably be most interesting for your area or have similarities to what you might be seeing in non-fatal cases in your area. So we will be giving all teams reports regardless of if you review cases or not, but that is our charge in the legislation. And then we're responsible for actually writing the legislative report that then the chairs of the state review team will be signing and moving forward. And then we'll be doing other kind of prevention and data products along the way.
Thank you for watching the first half of the Child Fatality Prevention System training. In this section, there was an overview of what child fatality prevention systems are, what child death review does, and the recent legislation that passed in the state of Colorado. In the second half of the training, you'll be able to learn more about how the system is going to be rolled out statewide, about regionalization of local teams, and the timeline for implementation, both the funding and getting case review started. So please feel free to watch the second half of the training as well. Thank you.